exactly what you said. But it is getting rid of all the microplastics, the deodorants, the chemicals, all of that stuff that increases estrogen. It's getting outside with your shirt off for vitamin D. It's heavy weightlifting with large muscle groups. It's vitamin D and zinc are the two most important. The herbs are probably going to be fenugreek and ginseng. And it's, and there are studies showing, vitamin D and zinc supplementation help dramatically. They showed that men that go out and chop wood have higher testosterone, produce more testosterone than men that are playing sports like soccer and basketball and other things that help increase it somewhat. And I think there's something physical. Listen, chopping wood is a full body exercise, but also I think there's something psychological there. Like I remember when my dad brought me out in the yard and taught me how to chop wood, which is appropriate because our last name is Axe. But he showed me how to do it. And I probably never felt more like a man when I was a kid than when I was chopping wood with my dad.
If I woke up tomorrow morning and I opened the blinds like I do every morning and I looked down and you were chopping wood, I would be so turned on.
With his shirt off, sweating.
Honestly, I can't believe I've never had you do that. That is such a fantasy for me. If you were chopping wood outside, I would be like, oh my God, get up here.
For the guys out there that are worried about their testosterone and, your girl's not letting you, get out there, shoot some guns, chop some wood, ride a motorcycle, do the shit that you're not supposed to do.
That's right.
Do the stuff society tells you not. If I was in that situation right now, I would grow a long ass beard and mustache. I'd be out there slamming that wood, shooting guns, doing all the shit.
You could chop some wood though. I'm fine with that.
You can't, because listen, it is a health issue, right? It is, you don't want to get in a position where you have this at a young age because it's going to only get worse.
It's a big marker of longevity and mortality. So if a man has low testosterone, it takes years off his life versus if it stays high longer, it adds years to your life. So it goes beyond vanity or even having kids. It goes to just, your general health.
So let's talk also about the reverse, which is birth control with women, because that's been a topic that's come up on this show a lot. And again, I think it's a sensitive issue because it taps into reproductive rights. But just let's focus in on specifically what you've seen the medicine do to people and maybe some of the things they should be aware of if they're deciding to use a birth control.
Well, what I'm going to share is probably going to surprise some people, but this is all based on clinical literature. One of the studies was a very large-scale study from the British Medical Journal. But to starters, the biggest thing I think that upsets me is that doctors are just prescribing this stuff like it's candy. And, there's a lot of young girls going in high school, and whether they're need a contraceptive or not, they are deciding to get on it for acne or just so they don't get their period for comfort. So doctors are saying, well, just get on it because, just to be more comfortable in life. And so I think just the way it's prescribed today is unethical. But also, people think when they read the label of a medication and they see the side effects, those are the only potential side effects. The reality is no medication puts on their label the nutritional deficiencies that the medications cause. So birth control pills, and this has been scientifically proven with multiple studies, deplete your body of vitamin B2, B6, folate, B12, zinc, magnesium, selenium, vitamin C, probiotics.
Wow.
All of those. And there was a study done in the British Medical Journal that found that if you take birth control for 10 years or just long term, it increases your risk of hypothyroidism by 283.7%.
And guess what I have? And guess when I got prescribed birth control?
Yep.
16 years old.
Do you know how many women? So my biggest entire surprise of all of when I first opened up practice, I'm my late 20, mid and late 20s, I think 26, started seeing patients for the first time. And I could not believe how many women